All right. Okay, so can we start?
Yes, sir.
Can
Yes, sir. You can start.
Yes, yes. Okay. So good morning once again, and welcome to the second lecture for microbiology. Okay, so today we'll be looking at the. Please, can you see my screen? Can you see my
Yes, we can
screen?
see.
Oh, all right. So
Yes,
today
sir. We can see.
we'll be looking at the chemical and we'll be doing 2 to 3 things today. We'll be looking at the physical and chemical properties of microorganisms, specifically bacteria. We'll also look at normal flora, and then we would finally look at vaginal and penile health. So some infections that pertain to our reproductive system, specifically our vagina, and then, the vagina of ladies, and then the penis of men. Then next week, God willing, we'll continue with other systemic infections that are caused by microorganisms. If you remember last week, I told you that we have communicable and then we have non-communicable diseases. Communicable are those that can be transmitted or transferred from one person to another, whether directly or indirectly, and it's caused by microorganisms. Another name for communicable is infectious diseases. Non-communicable are those that cannot be transferred from one person to another. And then another name is non-infectious diseases, and it is not caused by microorganisms. So for all infections that are caused by microorganisms, they are called infectious diseases. And such infections can be transferred from one person to another. Okay, so today we'll first of all look out for the physical and chemical properties of microorganisms, specifically bacteria. Okay, so as all living things require some specifications pertaining to life. Someone will say life and godliness. Example, someone will say that for me, when the room is too hot, I don't like it. I want a room that has an AC. I want colder temperatures. Someone will say that when the room is too cold, I get catarrh or I get flu. I don't like it. I want a room that is warm, like a honey hole, something like that. Someone will say that okay, when it comes to food, I love salt, so much salt, salty food. Someone will say, oh, I don't really love salt. Don't put salt in it. Someone will say, put a pinch of salt in it. When it comes to how do you call it? I mean, we all have even with relationships. Someone will say that I want a guy who is tall and I mean has hairy chest and all of that. A guy will say I want a lady with big butts, big boobs. We all have our preference and we have our specifications, what we call specs. Okay, so microorganisms also have specifications. They have their preferences when it comes to oxygen, when it comes to their feeding, when it comes to their temperature, when it comes to their salt, and when it comes to their pH or acidity requirements. Okay, someone will specifically go and buy how do you call it a fruit juice because it's too sugary. The person wants sugar. Someone will also go and buy biscuits that is salty, like those cream crackers. Some are salty and also, like I said, we all have our preferences when it comes to these things. So today we are looking at the physical and chemical properties of microorganisms. And then these chemical and physical properties of microorganisms relate around, their feeding, number one, their oxygen requirement, number two. And then we also look out for their carbon dioxide requirement, number three. We will look out for their temperature requirement. Okay, so all these things that I'm mentioning, the most important ones are three. Oxygen requirements, that is number one. Carbon dioxide requirement, okay, oxygen requirement, that is number one. Okay, temperature requirements, that is number two. And then the last one that we would look out for under this particular section for today will be specifically when it comes to their feeding. So we will start with the oxygen requirement, then we move on to how do you call it? Um, so for oxygen requirements, from there we will look out for temperature requirements, and then we'll go to salt and then let me say pH. So let's start with the oxygen requirement. So the oxygen requirement for microorganisms are here. So there are two key things that you need to look out for. Okay, you need to look out for the word obligates and then the word facultative. So here you can see obligate here, And then you can also see facultative here. I will explain, you don't want to worry. So obligate from the word obliged as an English word means it's a necessity. It's by force. When I tell you that you are obliged to be in my office at 9 p.m. or 9 a.m., it means this is by force. It's a necessity, it's a must. It is actually non-negotiable. You are obliged to come to my office at 9 o'clock. Okay. So understand the word oblige or obligate when it's used in relation to oxygen demands. Also understand the word facultative from the word faculty, like you see here, facultative. So facultative means if I have it, it is fine. But if I don't have it, I can live without it. We all want money. But if the money is not there, you still adjust to live without the money. So that is facultative. So facultative is that though the thing is necessary, and then I would want to have it, even if I don't have it, I am okay, and I can, I can improvise something in order to survive, even without it. So that is what we call facultative. But with obligate, it means that the thing is a necessity. You should get it. Without it, you will die. I need life. Without life, I will die. That is obligate. But facultative, I need life. But even if there's no life, I can maneuver and improvise some things to still survive without life. So now that we have understood the two words, that is obligate and then facultative or faculty, let's use them in relation to the oxygen requirements or the oxygen demands for microorganisms. So the first one that we will look out for is aerobic, as you see. See, the word aero is a Latin word that means air. So we have aeroplane, a plane that moves in air. Okay, so the word is aero. It means air. It is out of this Latin word that we have the English word air. So aero means air.
Hello,
Okay,
sir.
yeah.
Please, you said we are to talk about the chemical and then the physical properties of microorganisms. And those
Yes.
that you are listing, are they the physicals or the chemicals? So that we
They are
know
they are
where
both
we
physical and chemical. So if you have a
They
question,
are
just
both
put
physical
the
and
question into
chemical.
the comment section. I will have time for that. Do you get me? I'll have time for questions. Do you get me?
Please, I just wanted to
Hello?
know if we are dealing with chemicals and all that.
They are all together. You don't worry which ones are physical, which ones are chemical. They are all together. Some are even merged between physical and chemical. Some of them you cannot even distinguish them. So just know the topic, the subtopics I'm giving you. So now, because when I'm asking you a question, I will not ask you differentiate physical from chemical. No. So now I'm saying that we are treating chemical and physical properties. So now we are looking at oxygen demand. Oxygen can be physical, it can be chemical. It depends on how you are looking at it. So the key thing is just know the categorizations of bacteria when it comes to their oxygen demands. That is the objective for today's study. I hope it's clear. I hope it's clear.
Yes, sir.
All right. So the word aero means air. Okay. So when we say obligate aerob, obligate, I've already explained the word obligate. So obligate means it's a necessity. Aerob from the word air means air. So an obligate aerobic bacteria is a bacteria that necessarily needs oxygen to survive. Without it, it will die. Okay, so the first thing that you need to look out for is aerobic. And aerobic, I've written they require oxygen to grow. So without the oxygen, they will die. So when we say obligate aerob, okay, obligate aerob means that that particular bacteria requires oxygen to survive. Without it, it will die. Then we can have another term, obligate anaerobe. The word anaerobe, I've told you that aerobe means air. Anaerobe means without air. So the an in front of the aerobe means without it. So in medicine or in science, anytime you have the word a in front of a particular word, it means the opposite. So we have cellular, which means a cell, but we have acellular, which means no cell. Okay. So aerobe means air, but anaerobe means no air. So when we have obligate aerobe means that these are bacteria that needs or requires oxygen to survive. Without the oxygen, those bacteria will die. So we call them obligate aerobe. Then we have another one, we call them obligate anaerobe. So obligate anaerobe is a bacteria that does not require oxygen for its survival. In the presence of oxygen, it will rather die. So you see, the opposite of obligate aerobe is obligate anaerobe. For obligate aerobe, they require oxygen to survive. Without the oxygen, they will die. But for the obligate anaerobe, they don't have oxygen at all. Rather, in the presence of the oxygen, they will die. So that's the difference between obligate aerobe and then obligate anaerobe. So you see, we have aerobe require oxygen to grow. Anaerobe do not require oxygen to grow. So if I add obligate to aerobe, it becomes a bacteria. So an obligate anaerobic bacteria is a bacteria that requires oxygen to grow. Without oxygen, it dies. But an obligate anaerobic bacteria is a bacteria that does not require oxygen for its growth. In the presence of oxygen, it dies. Now, there is another term that is microaerophilic. The word micro means small. Aero means air. Philic is a Latin word that means love. Okay, philic or file. So we have, let me say, hydrophile. Hydro means water. Phile means love. So hydrophile means water loving. Okay, so microaerophilic bacteria. Micro means small. Aero means air. Philic means love. So technically, it's a small air, or let me say small oxygen loving bacteria. So what is a microaerophile bacteria? A microaerophile bacteria is a bacteria that loves to live in small concentrations of oxygen. When the oxygen concentration increases, they die. If there is no oxygen at all, too, they will die. So they require small concentration of oxygen. So we call them microaerophilic. Micro means small. Aero means air. Philic means love. So it's like small air, or let me say small oxygen loving bacteria. So these bacteria called microaerophilic require small oxygen. Normally it's about 10 to 15% of oxygen for them to survive. When the oxygen level is about, it's like 50, 60, they will die. If the oxygen level is also 0 to 5%, it will die. So you see, they are like in tree, we say a honey hole. So it's like they like it, it's like they don't like it. Okay. So right now I've explained 3 times. Obligate aerobe. This is a bacteria that love to live in oxygenated areas or places with oxygen. In the absence of oxygen, they will die. That is obligate aerobe. Then we have obligate anaerobe. These are bacteria that do not love to live in oxygen areas, or they love to live in places without oxygen. In the presence of oxygen, it will die. Then the third one that we have spoken about so far is microaerophilic bacteria. These are bacteria that love to live in small concentrations of oxygen, like 10 to 15%. When the oxygen concentrations are high, they will die. When the oxygen concentrations are low, they will die. So I've spoken to you about 3 terms now.
I see.
Okay. So the person saying I see, please keep quiet. So we have aerobic, we have obligate aerobe, we have obligate anaerobe, and then we have microaerophilic. Let's go to the 4th term. The 4th term that we will talk about is the word capnophile. You can see capnophile on your screen now. Capnophile. Okay, so capnophile are bacteria that love to live in small concentrations of carbon dioxide. Okay, so usually you will see on my screen that high concentration of carbon dioxide. So I'll explain, don't worry. So these are, when we say capnophile, the word capno is a Latin word that means carbon dioxide. Okay, so I spoke to you about 6 terms. So don't forget, we are still talking about oxygen demands, okay, or oxygen requirements of bacteria. So the first one I spoke to you about was the first one that I spoke to you about was obligate aerobes. What is an obligate aerobe? An obligate aerobe is a bacteria that love to live or must live in an oxygen area. Without oxygen, they die. Then I also spoke to you about obligate anaerobe. An obligate anaerobe is a bacteria that love to live in places without oxygen. In the presence of oxygen, they die. I spoke to you about microaerophile. Microaerophile are bacteria that allow to live in small concentrations of oxygen. In the presence, when the oxygen concentration increases so much high, they die. And then when there's no oxygen, they die. Okay, then I spoke to you about capnophile. Capnophiles are bacteria that allow to live in places where there are some levels of concentrations of carbon dioxide, like 10 to 15%. That is a capnophile. Then I spoke to you about facultative aerobe. So what is a facultative aerobe? Facultative aerobe is a bacteria that under normal circumstances would allow to live in places with oxygen. But if there is no oxygen, that particular bacteria will switch, okay, and then begin to live in a place where there is no oxygen. So facultative bacteria are those that are able to, live in between the two. So when we say facultative aerobe, it is a bacteria that under normal circumstance, okay, would have loved to live in places with oxygen. But if there's no oxygen, it can switch to anaerobic mode and then begin to live in places without oxygen. And then facultative anaerobe is a bacteria which under normal circumstances would have loved to live in places without oxygen. However, if it finds itself in a place where there is oxygen, it will switch to aerobic mode and now begin to use the oxygen. So these are the 6 categorizations when it comes to oxygen demands or oxygen requirement of bacteria. 1, obligate aerobe. 2, obligate anaerobe. 3, microaerophile. 4, capnophile. 5, facultative aerobe. And 6, facultative anaerobe. Now let's move on to talk about temperature requirements of microorganisms or bacteria, specifically bacteria. Temperature requirements of bacteria. So what we just did is oxygen requirement. Now we are talking about temperature requirement. When it comes to oxygen requirements, there are 3 categories. There are 6 categorizations: obligate aerobe, obligate anaerobe, facultative aerobe, facultative anaerobe, microaerophile, and then capnophile. These are oxygen requirements when it comes to bacteria. So now we are coming to talk about temperature or heat requirement. That one, it is only 3 categorizations. Okay. So the first one we'll talk about is a psychrophile. You can see it on your screen. Psychrophile or psychotroph bacteria. What is a psychrophile or psychotroph bacteria? These are bacteria that love to live in cold areas. Don't forget, we are talking about temperature now. So a psychrophile or a psychotroph is a bacteria that love to live in cold temperatures. So from negative temperatures up to say 10 degrees Celsius. Okay, so there are some bacteria, when you put your food in fridge, they can still cause the food to go bad. Because once you are putting the food in fridge, they even love to live in cold areas. Okay. Please, the person talking about earpiece. The person shouting. Hey, please, the person shouting, earpiece.
Oh, baby, come.
Please, the person saying baby, come. Can you mute yourself?
Come, baby, come. Baby, come. It's okay. Sorry.
It is meant to mute yourself.
All right. Since the person is not ready to mute yourself, I'm still teaching. So when it comes to temperature requirement, I've been asking the guy to make me a host so I can remove these people, but he's not making me a host. So when it comes to temperature requirement, we have 3 categorizations. So we have psychrophiles, we have mesophiles, and then we have thermophiles. The psychrophiles are those that love to live in colder temperatures. Okay, so negative temperatures to say temperatures of 10 degrees Celsius. So when a bacteria is a psychrophile and a bacteria finds itself in your food, if you put the food in the fridge, it will still go bad. So normally the salad that we have been doing, sometimes in fridge, it still goes bad. The reason is that most psychrophiles or most bacteria that love to live in cold temperatures are normally found on those cabbage and those leafy vegetables and those lettuce and those things. And then there's a bacteria that is in that is in AC, air conditioners. We call them Listeria monocytogenes. Those bacteria rather love to live in cold areas. So those of us who love to live in ACs, I mean, sometimes you live in an AC and it gets cold. If you're a pregnant woman, I beg you, don't really find yourself don't live in ACs more. Make sure the AC is clean because there's a bacteria called Listeria monocytogenes. That bacteria normally lives in ACs. So, and it can cause abortion. It's called Listeria monocytogenes, and it causes an infection called listeriosis, which causes abortion in sheep. And so it can also cause abortion in human beings. So if you're a pregnant woman, please don't love to live in ACs. So when we are talking about cyclophiles or cyclotrophs, these are bacteria that allow to live in colder temperatures. Example, negative temperatures like in freezer, and then in cold temperatures like up to 10 degrees Celsius. You know, your fridge temperature, the temperature of fridge is 2 degrees Celsius to 8 degrees Celsius. So these bacteria that love to live in these areas are called cyclotrophs, or let me say cyclophiles. The second one is mesophiles. The word meso is a Latin word which means moderate. Okay, moderate. So these are bacteria that allow to live in moderate temperatures. So they love to live around 25 degrees Celsius to 37 degrees Celsius. And then we are nurses. 37 is normal body temperature. 25 is normal room temperature. So any bacteria that allow to live in temperatures that ranges from normal room temperature to normal body temperature are called mesophiles. So, in fact, all the bacteria that causes infection in the human body are mesophiles. A lot of them are mesophiles because they allow to live in moderate temperatures. That is from 25 degrees Celsius to around, let me say, 40 degrees Celsius. And these are temperatures that human beings actually live in. 25 degrees Celsius is room temperature, and then 37, 38 is body temperature. So any bacteria that allow to live in temperatures ranging from 25 degrees Celsius to 40 degrees Celsius is said to be a mesophile. But any bacteria that allow to live in negative temperatures up to say 10 degrees Celsius is said to be a cyclophile or a cyclotroph. The third one is thermophile. The word thermo means heat. Okay, phile means love. So any bacteria that allow to live in high temperatures, like normally above 60 degrees Celsius, or sometimes we say temperatures above 45 degrees Celsius, we say that particular bacteria is a thermophile. So when it comes to heat or temperature requirements, we have three categorizations. We have cyclophiles. These are bacteria that allow to live in cold temperatures, that is negative temperatures, to 10 degrees Celsius. And then we have mesophiles. These are bacteria that allow to live in moderate temperatures, ranging from 25 degrees Celsius to 40 degrees Celsius. And then we have thermophiles. These are bacteria that allow to live in high temperatures, that is about 45 degrees Celsius. So when it comes to oxygen requirement or oxygen demand, we have six: obligate aerobe, obligate anaerobe, microaerophile, capnophile, facultative aerobe, and then facultative anaerobe. Now, when it comes to temperature or heat demands, we have three. We have cyclophile, we have mesophile, and then we have thermophiles. Now, let's go to pH. pH speaks of acidity, how acidic or how alkaline a medium is. When it comes to acidity or acid requirements, there are three categorizations. Okay, we have bacteria that are said to be alkalophiles. So these are bacteria that are allowed to live in alkaline or basic medium. So any medium with a pH of, let me say, 8 to 14 is said to be alkaline or basics. And such bacteria that allow to live in alkaline or basic medium are said to be alkalophiles. Alkalophiles. Okay. And any bacteria that allow to live in acidic medium or acidic pH is said to be acidophile. One example of such bacteria is the bacteria that allow to live in the vagina, called Lactobacillus acidophilus. We'll talk about it briefly. Okay. So we have acidophiles, we have alkalophiles, and then we have neutrophiles. What is an acidophile? It's a bacteria that allow to live in acidic medium, that is from a pH of 1 to pH of 6.9. Then we have neutrophiles. These are bacteria that allow to live in neutral pH, that is a pH of 7. And then we have alkalophiles. These are bacteria that allow to live in alkaline or basic pH, that is a pH of, say, 8 to pH of 14. Now, there are also bacteria that love to live in high salt areas, okay, high salty areas, and such bacteria are said to be halophiles. You can see on your screen halophiles. So what is a halophile? A halophile is a bacteria that require high concentration of salt to live. High concentration of salt to live is said to be a halophile. Halophile. So I am done with the physical and chemical properties of bacteria. I'll quickly use 5 minutes to take questions, and then I would go on. So if you have any question, I'm giving you 5 minutes to ask, and then I will I will quickly go on to the next section. So can we refer micro aerobies? Please, there's nothing like micro aerobies. I said micro aerophiles as capnophiles. Please, they are different. Micro aerophile is a bacteria that allows to live in small concentration of oxygen. Micro means small, aero means air, phile means love. So micro aerophile is a bacteria that allows to live in small concentrations of oxygen. That is 10 to 15%. However, capnophiles are bacteria that allow to live in places where there are some level of concentrations of carbon dioxide. That is 10 to 15%. That's the difference between them. So please, they are not the same. One is capnophile, one is microaerophile. And there are some questions that maybe came before I lost, so you have to resend them. Someone is saying, so what is the difference between microaerophile and capnophiles? I've said it again. Microaerophiles require small concentration of oxygen, that is 10 to 15%. Capnophile require carbon dioxide levels of 10 to 15%. So one is carbon dioxide, that is capnophile, and one is oxygen, that is microaerophile. So I have clarified that. So I think there are no questions. So those of you who love to live in AC, especially when you are pregnant, please take note. Don't love so much AC when you are pregnant. Okay. It has normally there's a bacteria called Listeria monocytogenes. It can cause abortion. So once you find yourself, so if you have been having constant miscarriages, take note. Maybe you love to live in AC areas whenever you are pregnant. Okay, just take. And then when you are pregnant, don't play with goats and sheep and punching in wine. That's what I'm talking about. Okay, so there's the bacteria love to live in sheep called Listeria monocytogenes. So when you play with goat and sheep and all of that, you can have it. And please, when you are pregnant and you want kebab and those things, make sure it's well cooked before you eat it, because the Listeria may be in the muscles of the nentrinam or the goat meat and all, and you can eat it and then you can get miscarriage, or let me say spontaneous abortion. All right. So let's go on. So the next thing that we will be talking about, we'll be talking about normal flora. So quickly, I'll go to normal flora, and then we would find out what normal flora is. So normal, you remember last week that I told you that out of 100% of microorganisms, okay, 95% of them does not cause any infection, and they are said to be commensals, whereas 5% causes infection, and that 5% that causes infection are said to be pathogens, if you remember very well. But I told you that this 95% that does not cause infection and are therefore called commensals, they may cause what you call opportunistic infections. What is an opportunistic infection? Is any infection that takes advantage or opportunity of your weakened immune system to cause an infection. So today, I want to introduce to you another thing called normal flora. So normal flora are aggregate or cluster of microorganisms that lives in a particular anatomical site of the human body, and they perform specific function. So what I'm saying is that not all microbes cause infection. There are some microbes that rather helps you, the individual. Example, there is a microorganism, specifically a bacteria called Lactobacillus acidophilus, that lives in the vagina. The name lacto means it has something to do with milk. So every woman gets what you call normal vaginal discharge. And this discharge is possible because there's a bacteria that got placed in your vagina called Lactobacillus acidophilus. And that bacteria makes sure that you have a milky vaginal discharge that naturally cleanses the vagina. It's a normal flora. It's a bacteria, but it does not cause infection. It's in your vagina to help you, to prevent infection, to prevent pathogens from entering into the vagina. Okay, so what is a normal flora? A normal flora is a mixture, or it's an aggregate of microorganisms that are found at the specific anatomical site of a particular of a human body, and then they perform particular infection. So there are three key words in the definition of normal flora. The first one is that they are mixture or aggregate of microorganisms. The second one is that they are found at a particular anatomical site of the human body. Number 3, they help the body and then they don't cause infection. They only cause infection when, so these are the conditions that makes normal flora cause infection. There are 2 conditions. One, when the normal flora leaves its particular anatomical site. Example, we have a bacteria on the skin. It's called Staphylococcus aureus. When it is on the skin, it does not cause infection. But when you have a cut on your skin and then Staphylococcus aureus enters into your blood, it can cause septicemia. It can cause urinary tract infection. So we say that the Staphylococcus aureus is taking advantage of the fact that it has changed its site. So when it's on the skin, it will not cause infection. But when it has chance and opportunity to enter into your blood, then it begins to cause infection. You see, the bacteria called Staphylococcus aureus, when it lives on your skin, because you sweat and then there's salt in the sweat, the bacteria has adapted to live in salty areas. So Staphylococcus aureus, we can say, is a halophile. It allows to live in salty areas. So once you give it opportunity or chance to enter into your blood, it will find an organ in your system that also produces a lot of salt, and that is your bladder. So once it finds place in your bladder, then it can cause urinary tract infection. So we are saying that normal flora is a mixture of microorganisms that lives in a particular anatomical site of the human body. And then they do not cause infection. They rather help the body. Now, so they are normal flora in the nose, they are normal flora in the mouth, they are normal flora in the ears, they are normal flora in the urogenital tract, and then they are normal flora in the gastrointestinal tract. What they mean is that all these places, please, the person talking should mute yourself. So all these places, there are some microorganisms there which do not cause infection. Okay, they rather help the body to undertake certain metabolic activities or certain metabolic functions. Okay, so in your nose, there's a normal flora. In your mouth, there's a normal flora. In your ears, there are normal flora. In your urogenital tract, when you say urogenital, you are talking about your urethral tract and then your cervical tract. Okay, but for men, we don't have cervical tract. We only have urethral tract, because women have 2 holes, men have only 1 hole. After this section, I'll talk to you about penile and vaginal health, so you understand some of these things. And then we have gastrointestinal tract. We have some bacteria that lives in your stomach that do not cause infection under normal circumstances. Okay, until you become an HIV patient, or until maybe you get pregnant, or until you become immunosuppressed, or when you allow these bacteria to change their anatomical site. Please note, normal flora do not cause infection so far as they live in their specific anatomical site. They only cause infection when they change their anatomical site. So like I said, Staphylococcus aureus lives on the skin and it does not cause infection. Once it leaves the skin and gets into the blood, it begins to cause an infection. Okay. Now, normal flora, the normal flora that we have in our body depends on these factors: the age of a person. It also reflects on the genetics of a person. It also reflects the environment of a person. There are some people, like, let me make this example. When you go to the north, let me even start from here. When you are in Kumasi and then you do typhoid test for you without test, and then you get, normally when you report 1/40, 1/20 is negative. 1/40, you have some level of infection. 1/80 means the infection is high. 1/160, you have high infection. 1/320, you have very high infection in the lab when it comes to without test for typhoid. Do you know that in Kumasi, someone may have 1/160 and a person will be seriously sick and dying? You can go to the north, specifically Upper East region. Someone have a typhoid level of 1/320 and the person is working normally. The reason is that those people, some of them are deprived when it comes to sanitation and all. So there's high typhoid or typhoid areas in Upper East region. I've lived there before, so I know what I'm talking about. So you see, the people there have gradually become used to the bacteria called Salmonella typhi. So even when Salmonella typhi is in their system, it doesn't really cause them any harm. They are used to the bacteria. So the bacteria is gradually becoming a normal flora to them. But when you move from the south here, say Accra, Kumasi, and then you go to the north, and you go and drink that same water that they drink, you'll be running and you may die. Simply because the Salmonella typhi, to you who is in Kumasi, when you go to the north, is a pathogen to you, but to the person who is already living in the north, is gradually becoming a normal flora. So your environment depicts which microbe is a normal flora to you and which microbe is not a normal flora to you. A white man may leave his or her country, come to Ghana, and then get some infection and may die. You are living in Ghana, you have been exposed to this infection several times. So gradually, the pathogen that causes this infection is becoming a normal flora to you. So your environment also reflects which bacteria is a normal flora and which bacteria is not a normal flora. And then the nutrition of a person, the food you eat, whether you are healthy or not, are you malnourished or not, also reflects how do you call it? The kind of bacteria that you have as normal flora. And obviously your sex. A male will not have Candida albicans as a normal flora. A male will not have Lactobacillus acidophilus. These are two. The Candida albicans is a fungus, and then the Lactobacillus acidophilus is a bacteria, which is a normal flora that lives in the vagina. A male does not have a vagina. So your sex or your gender also determines the kind of microorganism that you have as a normal flora. Please take note, there are some places in the human body that can never have microorganisms there as normal flora. Once you have microbes there in these areas, it means you are sick. The blood is supposed to be sterile. The brain is supposed to be sterile. Your muscles are supposed to be sterile. Your cerebrospinal fluid, that's your CSF, is supposed to be sterile. And then to some extent, your lungs are supposed to be sterile. Once you have bacteria or microorganisms in these areas, it means you are sick. 1, blood. 2, brain. 3, muscles. 4, cerebrospinal fluid. And 5, your lungs. These places are not supposed to have bacteria there as normal flora or any microorganism there as a normal flora. Once you have microorganisms in these areas, it means you are sick. Okay, so brain, blood, muscles, cerebrospinal fluid, and then the lungs are supposed to be free of microorganisms. Once you have microorganisms in these areas, it means you are sick and you need treatment. What are the advantages of normal flora? So there are 5. Let's look at the disadvantages first. So there are 2 disadvantages of normal flora. You see, we said that once the bacteria continue to live in its particular anatomical site, it will never cause an infection. So if you have Lactobacillus acidophilus in your vagina, it will not cause an infection. But when it leaves your vagina, let me say it comes to your mouth, the lesbians, and then the guys who have been licking the ladies. When you go and lick a lady and you pick Lactobacillus acidophilus, when it's in the vagina, it will not cause infection. But when it comes to your mouth, it may begin to cause an infection. When a Candida is in the vagina, all things being equal, it should not cause an infection. But when it comes to your mouth, if you go and lick someone, the lesbians and once again the chronic lickers, the guys who are always under blankets licking ladies, the chronic lickers, you may get oral thrush when you go and lick a lady with Candida and all of that. So you see, once the microorganism continue to live in this particular anatomical site of the human body, it will not cause infection. But when it moves from that place and goes to another place, it begins to cause an infection. So normal flora, when they change their anatomical site or location, they cause an infection. So they become pathogens or infectious when they change their anatomical site. And then 2, when the individual becomes immunocompromised or becomes immunosuppressed, then or becomes debilitated, then this same normal flora begin to cause an infection. I told you last week that what kills an HIV person is not the virus, but the fact that commensals or normal flora are now becoming pathogens. So you see, all of us have been exposed to tuberculosis, but we don't have tuberculosis simply because we are immunocompetent. Our immune system is strong. But once you get HIV, the bacteria that causes tuberculosis, Mycobacterium tuberculosis, now takes advantage of a weakened immune system and begins to cause infection. HIV is acquired immunodeficiency syndrome. Syndrome is a cluster of infection. How does HIV people get cluster or different infection? It's because any bacteria or any pathogen that may not have caused infection in a normal person is now causing infection. So you lead to, or at least what we call syndrome, aggregate of infection. Okay, so this normal flora, though they are there to help you, they take advantage of your immunocompromised immunity and then they cause an infection. So what are the 2 disadvantages of normal flora? They cause an infection when you become immunocompromised or immunosuppressed, or when you become debilitated. That is number 1. And then number 2, when they change their anatomical site where they are supposed to be, when you through your behavioral stuff allow them to move from that place and you go to another place, then they begin to cause an infection. Now, however, they have this importance. Okay, so some normal flora produce vitamin B and then vitamin K for the human body. I mean, the normal flora or the bacteria that live in your intestinal gut, they produce vitamin B and vitamin K for the human body. Okay, so it's like a mutualistic association. You are giving them food because when you eat, they also eat from your food. Okay, and then they are also providing you with vitamin B and then vitamin K. Okay, so that is it with normal flora. So they have a lot of advantages. So they produce vitamin B and K for the human body, number one. And then number two, they prevent infections. Okay, they prevent you from getting infections. Okay, so what it means is that you have lactobacillus acidophilus in your vagina. So when any bacteria that may cause infection comes to the vagina, the place that pathogen or that disease-causing microorganism would have inhabited or would have lived, the normal flora is living there. So you are going to propose to someone. The person has a boyfriend or girlfriend already. So the place that you want to occupy, there's someone occupying it already. So there's no place. But now you can have 3 girlfriends and a woman too can have 4 boyfriends. So it doesn't matter anyway. But when it comes to bacteria, the place that the bacteria want to live and cause an infection, there's a normal flora living there already. So you see, I mean, they prevent and protect you from getting infections. Okay, so one, they produce vitamin B and K for the human body. That is number one. And then number two, what I was explaining is that that's the last one. The normal flora may antagonize other bacteria through the production of substances which may inhibit or kill other microorganisms. What it means that this normal flora produces some chemicals that are dangerous to other bacteria that may cause infection to your human body. So when these bacteria that are infectious to you are coming, then the normal flora will release some chemicals, some venom, some toxins, some poisonous substances that may create a zone where the bacteria that under normal circumstances wanted to cause infection will not go beyond that zone. So let me say you have a boyfriend who has a lot of money. So when another person is proposing to you and then that person is broke, it's very difficult for you to accept the broke person, because you are broke, you are coming to take the girlfriend of someone who has money. So you see, the money has created a zone for the lady, a protective zone for the lady. So the money is like that dangerous chemical that I'm talking about. So the person who has no money and coming to propose to you, he cannot come into the zone because the money is there. The person has no money to counteract the one who has money. So the normal flora produces chemicals that antagonize, or chemical that prevents the infectious pathogens from coming close to you to even cause an infection. Okay, and then which other infection importance again? The normal flora constitutes a protective host defense, occupying. So these were the first one I was talking about, occupying ecological niche. So the normal flora are occupying places that the pathogen may have occupied. Okay, so there's no place for the pathogen that is about to cause an infection. There's no place for it to occupy. That is number one. Number two, they produce vitamin B and K for the body. Number three, they prevent you from getting infections. And then number four, they release chemicals. Okay, chemicals that antagonize other pathogens from coming into the human body. And then the last one, which I think is not here, is that some of them help you in your metabolic activities. Example, the normal flora that are found in your intestines. Okay, they help your body to metabolize some of the food substances that we eat. Okay, so when we talk about a normal flora, the image on your screen is what we are talking about. Okay, so there are normal flora that are found in several parts of the human body. Okay, so the arrow points to that particular part of the human body, and then the type of normal flora that is there. Hey, the person talking and laughing, can you please stop? Hey, those talking, please mute yourself. So the arrow points to which part of the human body, which specific anatomical site that we are referring to, and then the bacteria and then the other microorganisms in the boxes refer to which bacteria are found in those areas. So these are what we call normal flora. So example, I'll quickly take some questions. So please, if you have a question on the normal flora, oh, please, those talking, can you please be quiet?
Yakubu, mute yourself.
Oh, can't you at least comport yourself? Oh. So I'll quickly take some questions. When it comes to the normal flora, you can type the questions into the comment section, or you can ask. You can raise up your hand. I'll call you and then you ask. Before I move to the last section for today.
Yakubu Amalebe, please mute yourself.
Alangre Yakubu Amaleba, can you please mute yourself?
Just take him off, Keke.
No, I've been asking them to make me a host. They have not made me a host, so I can't take anyone out. So please ask your question. You can type it in the comment section, or you can raise your hands. I'll call you. Please be fast. You have like 5 to 10 minutes to answer questions on normal flora. So far, what we have done today, we spoke about the physical and chemical properties of bacteria. We considered oxygen demand, temperature demand, salt demand, and then pH demand. For pH demand, we said a bacteria can be acidophile. It means allowed to live in acidic areas, a pH of 1 to 6.9. Neutrophile are bacteria that are allowed to live in neutral areas, pH of 7. Alkalophiles are bacteria that are allowed to live in alkaline areas, pH of 8 to 14. We spoke about bacteria that are allowed to live in salty areas. They are called halophiles. Sometimes we use the word saline. The bacteria is saline, or the bacteria lives in halophilic areas. We also spoke about the temperature requirement. We said some are cyclotrophs or cyclophiles. These are bacteria that love to live in cold temperatures or cold areas. Okay, and that these are bacteria that love to live in negative temperatures, so temperatures of about 10 degrees Celsius. And I told you that the fridge temperature is 2 to 10 degrees Celsius. Freezer temperature is negative 20 to negative 35 degrees Celsius. So any bacteria that love to live in negative temperatures up to 10 degrees Celsius is said to be a cyclophile or a cyclotroph. A bacteria that is said to be a mesophile is a bacteria that allows to live in moderate temperatures ranging from 25 degrees Celsius to 40 degrees Celsius. A bacteria is said to be a thermophile when that particular bacteria allows to live in extreme heat or extreme hot areas, like about 45 degrees Celsius. We came to talk about, and so that is temperature requirements. We spoke about oxygen requirement. We spoke about obligate aerobe. We said this is a bacteria that necessarily requires oxygen to survive. Without it, they die. We spoke about obligate anaerobe. These are bacteria that extremely do not require oxygen to survive. In the presence of oxygen, they die. We spoke about facultative aerobe. These are bacteria that, under normal circumstances, would love to live in oxygen areas. However, in the absence of oxygen, they are able to switch to anaerobic state and survive. We spoke about facultative anaerobe. These are bacteria that, the person telling me to slow down, I am recapping. I taught this already, or I've taught this already. I'm only recapping. So that's why I'm moving fast. Material read that. So I'm only going over. So if I slow down like I'm still teaching afresh, then we won't finish the course. So I spoke about, so let me take the oxygen demands again. I said obligate aerobe. These are bacteria that allow to live in oxygen areas. The word obligate means obliged. It's a necessity. Without oxygen, they will die. So they love to live in oxygen areas. Then I spoke about obligate anaerobe. These are bacteria that do not love to live in oxygen areas. In the presence of oxygen, they rather die. We spoke about facultative aerobe. These are bacteria that love to live in the presence of oxygen. However, in the absence of oxygen, they switch. So when it comes to the obligate, they need this. Without it, they will die. But when it comes to the facultative, they need this. But if they don't get it, they can switch. So for facultative aerobe, they need oxygen. Without the oxygen, they can switch to anaerobic states. Then the facultative anaerobe, they don't need oxygen. But in the presence of oxygen, they will rather switch to use the oxygen. We spoke about microaerophile. So these are bacteria that love to live in small concentrations of oxygen, like 10 to 15%. We also spoke about capnophile. These are bacteria that love to live in places with small, with a concentration of carbon dioxide that is 10 to 15%. So this is what we have done so far. And then the last thing we spoke about was normal flora. Okay, normal flora. And so we said that for normal flora, these are aggregates or mixture of microorganisms that are located at a specific anatomical site of the human body, and then they do not cause infection, rather they help the body. However, there are two disadvantages. The first disadvantage is that when they change their specific anatomical site or location of the human body, then they begin to cause an infection. Example, there is a bacteria that is called Staphylococcus aureus. It lives on your skin. It may not cause infection whilst it is on your skin. However, when it leaves your skin and then gets to another part of the human body, like the blood, they can cause septicemia or urinary tract infection. Also, the second disadvantage is that of normal flora is that this normal flora that we are talking about, okay, when you become immunocompromised or immunosuppressed, they take advantage of your compromised immune system, and then they also cause infection. These are the disadvantages. What about the advantages? They have about 5 advantages. The first one is that they produce vitamin B and K for the human body. The second one is that they inhabit the places that the infectious pathogens would have inhabited. The third one is that they produce chemicals that prevent infectious pathogens from coming close to the body. The fourth one is that they help us in the metabolism of the food substances that we eat. And then the last one is that they help the body to prevent and then to protect infections. This is a summary of what we have done so far. We are left with the last one, which can take like 30 minutes. So let me use the rest of the time to take some questions before we move to the last section. That will be about vaginal and penile health. Quickly, sir, please, when normal flora is plenty inside the vagina, what does it imply? There's nothing like normal flora plenty inside the vagina. The vagina has basically 2 microorganisms in there. He has Lactobacillus acidophilus, which is a bacteria, and then he has Candida albicans. In the next section, that's what we are coming to do. So I will elaborate on that. I will speak about that one. So don't worry. Someone said, is there an instance where normal flora can reduce in number or even deplete in some anatomical site? Yes. Those of you who abuse antibiotics, if you abuse antibiotics so much, there are some bacteria which are found in specific anatomical sites on your human body, which actually help you. So once you abuse your antibiotics, you kill those bacteria in those specific areas, and then the importance or the relevance of those bacteria will be taken off. And that's why sometimes you'll be there and then you unnecessary diarrhea, because the bacteria that would have helped you to break down your food, you have taken antibiotics to wipe them off. So when those bacteria die, your food will not be digested very well. Sometimes you'll be there and you'll not be able to poo. Like for days you are not able to poo. Some of the reasons is that you have been abusing antibiotics, and so the bacteria that is supposed to help in the digestion, you have killed them. So it takes time for new ones to come. So it's possible. So say, is it possible to be infected with lactobacillus from the vagina with your penis? No, please. Lactobacillus acidophilus on the penis does not cause an infection. However, in the mouth, they may become infectious. We are coming to talk about vaginal and penile health in the next session, so don't worry. So please, what is the difference between normal vaginal discharge and candidiasis discharge? We will talk about it in the next session right away. Please, do antibiotics affect our normal flora? Yes, when you abuse them. When you take them normally, they don't affect it. But when you continue to abuse antibiotics, they affect your normal flora. One thing that also affects normal flora is diabetes. Another thing that affects normal flora is when you are pregnant. But you see, diabetes and pregnancy, they are normal. You don't have any control. But for abusing of antibiotics, you have control. So please stop and educate your patient and client that come to you to stop abusing antibiotics. Sir, please, can you kindly slow down? Yes, I will slow down. Sir, please, does douching affect normal flora? Yes, I am coming there. It's a big yes. The Achesa Genicure 442, Pashim, Fabum, Fetchum, Fetria. Those things, Venfem, Genfem, Pashim, Chili, vaginal steamers, wine, those things that we have been using to shade the vagina, to tighten the vagina. I'm coming there. That's the next section. All those things that you have been doing, the douching, scented soups, those things that you have been doing, they are those things that causes all sort of vaginal infections. That's the next section. I'm coming there. Those antibiotics are herbal medicines included. No, please. No herbal medicine is included. Sir, please, what causes plenty vaginal discharge? I'll be coming there. Many ladies have diarrhea. Is this because of the abuse of antibiotics? Well, that is up to them. I cannot tell. I can only teach you microbiology. Like I said, don't abuse antibiotics. Once you abuse antibiotics, sometimes you may get unnecessary diarrhea because the normal flora in your intestine can be depleted. Isn't there a way to replenish the depleted normal flora? There is a way, but it takes time for them to come. So stop the things that get them depleted. All right. So we'll go straight away to talk about please, does abuse of antibiotics cause dryness and itchiness? Yes, I'm coming there. That is what we are coming to do right now. It's a roller coaster. Let's go on. So I'm coming to share my screen, and then you would go ahead to talk about vaginal, and then penile health. So those of you who are involved in those kind of stuff, please stop.
Hello.
Yeah, hello.
Please, so you see, some ladies also have their menses and always complain of getting diarrhea. Is it because of the abuse of antibiotics?
No, those are hormonal.
You see, when you are menstruating, one particular hormone that is really on top, okay, it's progesterone. Okay, and you see, some people when they are menstruating, they have rashes on their face. Sorry, Mr. Rashes, how do you even call it? Pimples. Some people will have diarrhea. Some people will not be able to. You see, these are hormonal, and it has nothing to do with depletion of normal flora. I'm talking about you not having your menses, but I mean you are getting unnecessary diarrhea. You are not able to poo. Those things mostly is because of abuse of antibiotics. Okay, that's what I'm talking about. Yeah, are you okay? Yeah. Now let's talk about vaginal and penile health. We have roughly 30 to 40 minutes to do this. Please, you are health workers. I went to CODeL as a specialist in microbiology, and then a lady, a nurse, had gotten vaginal atresia, and I was called to come and give my special or my specialist knowledge. And do you know vaginal atresia? You are nurses. So when I read the history, this lady, a TikTok person, I don't understand, a nurse, wako school, and she got a diploma, someone on TikTok, JSS liver, send his can I now the person recommended this HSR for this lady, and this lady bought it, and because it was good, we used to say so she was not able to menstruate, or yes, the menses comes, but it doesn't come out of the vagina. She's not able to pee. So now this lady was put under the knife for surgery, simply because the church VFM, JFM, Petri, Fashe, Fabo, Petria, Fache, Chili, vagina steamers, vagina cleansers, vagina titan. And those of you who have been buying boric acids, you don't even know the particular concentration of boric acid you need. You need 4% of boric acid. And even that one, we recommend it for those who have diabetes and then they pee a lot. So I am not say simply because of the fact that the peeing makes them some way. So when you put boric acid there, it preserves the ecology or the flora of the place. We don't use boric acid because of person will catch it. No, we don't do that. But the ladies abuse it, and then unfortunately some nurses also and midwives, health workers also abuse it. You go and buy boric acid, you don't even know the concentration, high concentration, and then it kills the normal flora there, and then you begin to get abnormal discharges, and then all of that. So please, I'm coming to educate you on vaginal and penile health. Okay, so please take note, and then just follow carefully, and then see how things will go, so that you can educate your clients. Now, this is a normal vaginal ecology. Okay, so we will be talking about bacterial vaginosis, genital herpes, oral and vaginal thrush. And then don't allow these things inside you. I'll show you endocervicitis, which is called gonorrhea in a woman, and then trichomoniasis and all of that. So, of course, this is how the female tract looks like. So, when you are being knocked, or when you are being fucked, or when you are having sex, the penis goes through your vagina, gets into your cervix, and then enter. If nipano bemawa, it can push your cervix and enter into your womb. Okay, so that is the tracts. Please note that a woman has 90% chance of getting an infection from a man when a man is infected, but a man has only 10% chance of getting an infection from a woman. That is why many women have STIs, sexually transmitted infections, because a woman has 90% chance of getting an infection from a man, but a man has only 10%. Let me break it down for you to understand. If I have HIV and I sleep with 10 ladies who do not have HIV, I'll give it to 9 out of the 10. But if a woman has HIV and she sleeps with 10 men who do not have it, she can only give it to 1%, or let me say 1% out of the 10. This is how women are not treated for when it comes to infections. The simple reason is that, this is the simple reason. Women have a bigger hole compared to a man. The hole that is in the penis of a man is too small for the man to contract some infections, number one. But the vagina hole is bigger. Also, almost always the woman is down and then the man is on top. By gravity, the semen moves from the man into the vagina of the woman. Hardly can a vagina discharge from a woman climb up into that small hole of a penis. This is one of the explanations. So woman has high surface area to volume ratio when it comes to receiving discharge from a man compared to a woman giving her discharge to a man. That is number one. And then number two, almost always a woman is down, a man is on top. So obviously, the man gives it to the woman. Hardly would the woman pass more, the discharge through that hole. The second point is that women have two holes. They have the hole for urination, the urethral hole. and then they have a hole for sex, the cervical hole. A man has only one hole. So when a man is having sex with you, he can never feel like urinating. But a woman can urinate during sex because the passage for urination for a woman is different from a passage for sex. They are two different things altogether. A man has only one passage. The passage for urine is the same passage for sex. So you see, when a man has sex with a woman, right after sex, the man can go and urinate. Apart from the fact that the man has bruises or ulcers on the penis, which may expose the man to get infection from the woman. If the man is clean and has no bruises or ulcers on the penis, right after sex, if the man goes to urinate, he can cleanse almost about 90 to 95% of all the pathogens that he has contracted from the woman. But for a woman, when a man has sex with you, the microbes that the man is giving to you passes through your cervix into your womb, and then they disseminate to their targeted organs. But when you are urinating, you urinate through your urethra. So the passages are different. That is one of the explanations why a woman is always at risk. But you see, a man has 10% chance of getting an infection from a woman. But it depends on the sex style. If the woman is the one riding the man, if the woman is on top and then the man is down, then you see, people tutu kogu pumua said dani butua. When at the end dani butua, people tutu. So when the man is down and then the woman is on top, then you see what happens actually is that the woman now has a higher chance of giving an infection to the man because the woman is on top and then the man's penis is up. So that small hole which is in the penis of the man can now be opened a lot more to receive the discharge from the woman. So it's like the mortar is on top and then the pistol is down. So it is easier for the fufu to move from the mortar to the pistol. It's easier. Now, this is how the vaginal environment looks like. The vagina is acidic and has a pH of less than 4.5, as you see on your screen, simply because there's a bacteria called Lactobacillus acidophilus. This bacteria, God in his own wisdom, please mute yourself. Someone is making noise. Mute yourself. There's a bacteria called Lactobacillus acidophilus that lives in the vagina. This bacteria called Lactobacillus acidophilus loves acidic environment. So it produces a normal acid that naturally cleanses the vagina. So God in his own wisdom gave you a natural cleanser, which is a normal flora called Lactobacillus acidophilus. The name is lacto, so it means it has something to do with milk. That is why the normal vaginal flora is milky. It's milky. So you see, the vagina is like a barrier, and then the policeman there is the Lactobacillus acidophilus. The unwanted goods are those that are coming to enter into the vagina. So once the policeman, which is the Lactobacillus acidophilus, is there, it prevents unwanted goods. However, Candida albicans, which is a fungus, is also a normal flora in the vagina. But the number of Candida albicans is too small compared to the number of Candida lactobacillus. So the lactobacillus is the police officer. It has the numbers are high, but the numbers of Candida are low. So when you use your Genicure 442, VFM, Achesa, Chili, Fashim, Fabum, Fetri, Fache, Maninche, those things that you have been using, vaginal stimulants, when you do that, and sometimes diabetes and hypertension, diabetes and pregnancy, and then when you abuse your antibiotics, when any antibiotics that you take, when you urinate, it comes out of your urine because the liver and then the kidney excrete it out of the body, the extra ones. So when the antibiotics pass it through your vagina, when you are peeing, it kills the Lactobacillus acidophilus. And then gradually the numbers of the Lactobacillus acidophilus will go down. When the numbers of the Lactobacillus acidophilus goes down, then the numbers of the Candida will rise. Don't forget, it's the Lactobacillus acidophilus that makes the vagina acidic. So when it goes down, the Candida albicans will rise. Then you begin to get white. This is how candidiasis comes about. Please, and please again, I'm shouting to tell you, you don't get candidiasis from the toilet. You don't get candidiasis from eating toffee. You don't get candidiasis from anywhere. You get candidiasis because your vaginal normal flora has been imbalanced because of these things. Sometimes, I understand. When you go to toilet, and then you are on the WC, and then maybe the person did not flush, and then you also sit on it, and the person has candida. Sometimes there can be a splash, and that splash can get into your vagina and get white. But my dear brothers and sisters, how often will you sit on a WC and there will be a splash? How often do you sit on a WC that the person who uses before you did not splash? So the real 99% of cases of candidiasis comes about because of these things. Your behavior Some people go as far as putting Dettol in their vagina. Please, you can put the Dettol in the water that you are using to bath, and then the concentration comes down. You can use it to, you can just put some in the vagina and cleanse it, but don't put the raw Dettol into your vagina. Don't insert anything into your vagina. The natural cleanser is Lactobacillus acidophilus. It's a natural cleanser. So it cleanses the vagina naturally to bring what you call natural normal discharge that looks like a milk. So the day that you people, you do these things and then Lactobacillus acidophilus dies, then Candida albicans will come up. The numbers will grow. The numbers of Candida will grow. Then you begin to produce what you call abnormal discharge. It's abnormal because this discharge is not coming from Lactobacillus. It's coming from Candida. That's when the abnormal discharge begins. The vagina is no more acid. You see, semen is base or alkaline. Vagina is acid. So by normal chemistry, when you have sex and then there's a smell in the room, please, it's not from the man, it's from the woman. Because any infection from the man is visible. You can see on the penis. But a woman, not all infections can you see because some of them are inside the vagina. So when the vagina turns from being acidic to become basic, don't forget the semen from the man is also basic. So when the vagina has no infection and is acidic, a man is basic. So when a man sleeps with you by normal chemistry, acid plus base gives you normal or neutral salt. So there's no sense. But when the vagina becomes basic, the semen that is coming from the man is also basic. So base plus base equals to bone. So your vagina will bone, a hobby bone. So whenever you have sex and then the place smells, it means the woman's vagina ecology has been changed. It means the Lactobacillus acidophilus have all died simply because of the woman's use of antibiotics or abuse of antibiotics, or the woman has been putting something there which has killed all the normal flora there. So this is from Tech Junction, Tech Hospital. Okay, this is Candida on this is my finger, candidiasis, with the glass. So we have to attend to a patient, and when you put your hands into the vagina, you can bring the Candida out like banku. So you see, the normal vaginal discharge is supposed to be consistent. When you put your hand in it, it should be saying like okra, like we say, it's consistent, like okra. It should follow your hand. The very day that your normal vaginal discharge is not following your hand, when you touch it like okra, but it comes like banku, like you can break it. It breaks into pieces. It means you have candidiasis. We call it cottage cheese. Cottage cheese. So you see, this is how candidiasis comes about. Like I said, diabetes or immunosuppression or obesity, these are things that can trigger candidiasis because these are things that kills your Lactobacillus acidophilus and now allows Candida to actually grow. Okay, so what are the symptoms of Candida? There's increased amount of discharge. There's white, clumpy cottage cheese. Cottage cheese, like your normal discharge, comes like bangu. Okay, comes like bangu. That's what we call cottage cheese. And then there's redness, itching, burning in vagina, and then the vulva area. I'll talk about bacterial vaginosis and I'll take some questions. Now, please again, bacterial vaginosis is one thing that I pray no woman gets it. I pray no woman gets bacterial vaginosis. Now, bacterial vaginosis makes the vagina smell like a rotten fish. Bacterial vaginosis makes the vagina smell like a fishy odorous smell. In fact, bacterial vaginosis is similar to you putting a fish or meat in your fridge, and then you travel for 10 days, and immediately you left, there was light out. So for 10 days there was no light. You put fish in your fridge. So when you come and then you open the fridge, you see the smell that comes out from the rotten fish. That's the smell of bacterial vaginosis. In fact, when you have bacterial vaginosis and then you wash your panties and then it does not really dry well and then maybe it's about to rain, you ask someone to remove your panty for you, and the person gets closer, the person will not be able to remove the panty. In fact, bacterial vaginosis is what makes most women say that when most men come to me, they go. Most of them is not spiritual. You have bacterial vaginosis. In fact, there are 3 places in the human body when they smell. If you are not bold, you cannot tell the person. Like your mouth smells, your armpit smells, and then your vagina smells. It's very difficult to tell a person. Very, very difficult. Very, very, very difficult. Okay. So for bacterial vaginosis, what happens is that when the Lactobacillus acidophilus dies, there are other bacteria that gains ascendancy in the vagina and produces some chemicals that makes the vagina smell fishy whenever there is sex. So the room, it doesn't matter the spray you use in the room. You can open all the rooms. The room will still smell. So sometimes you sleep with a woman and then there's a fishy odorous smell. But when you go and borrow the room from a friend and then you have sex with your girlfriend, I'm not sure the friend will give the room to you again. The room will smell simply because the woman has what we call bacterial vaginosis. But for bacterial vaginosis, no matter how well the man has mean you, he will not be able to sleep with you. Even if he is, you see, you enter into the vagina one and you come out. When you enter the second time and you come out, the smell that comes from the second one is more than the first. When you enter the third time and you come out, the smell that comes out is more than the second. When you enter the fourth time and come out, the smell that comes out is more than the third. So it's an exponential scented growth. The scent is too much. And so the man will stop, no matter how. You see, the more the woman gets wet, the more the smell actually comes into the room. And that's bacterial vaginosis for you. When they come to the hospital, they confine more in the men who are doctors than women. So I get to hear a lot of these things, and I get to really intervene and try. Okay, so that is it with bacterial vaginosis. Okay, what are the complications of bacterial vaginosis? It can lead to preterm labor and low birth weight. It can lead to post-vaginal hysterectomy. Please mute yourself. It can lead to pelvic inflammatory disease. It can lead to UTI. Oh, the person talking, mute yourself. What sort of? And it can lead to amnionitis, inflammation of the amniotic sac. Okay, I'll pause here. No, let me take herpes. So this is a vagina with herpes. On your screen, you have vagina with herpes simplex virus infection 2. Remember last week I spoke to you. Who is talking?
Paul, meet yourself. Paul, meet yourself.
So on your screen, we have a vagina with herpes simplex. Remember last week we spoke about herpes viruses. So this is herpes simplex virus 2. Remember we said herpes simplex virus 1 infection causes oral infection like cold sores, what we call inyahuni in tree, or cold sores, and those rashes on your mouth. So this is herpes simplex virus 2. That's human herpes virus 2 infection. You can see that there are some places on the vagina that is swollen a bit. Okay, the vagina has protruded. This is all called herpes simplex virus infection 2. Okay, and that's how it comes out. So for this one, there is a papule or a pimple that would be filled with pus or water, and when it lyses or when it breaks or ruptures, and then it will erode, and any other part of the human or the vagina that it touches, that place will swell again. So this is a vagina, and with herpes simplex virus infection 2. Okay, all right. This is vaginal or oral thrush. Okay, vaginal thrush is chronic candidiasis. Oral thrush is chronic candidiasis in the mouth. If a woman has oral thrush, it means that the woman is either a lesbian or the person has HIV or is immunocompromised. If a man has oral thrush, either the man is HIV patient or the man is a chronic licker. In fact, he has been licking a woman who has a chronic candidiasis. Okay, this oral thrush, candidiasis in the mouth, and then this vaginal thrush. This is where the candida has become so chronic that it has become a thrush. Okay, now look at this. Would you love, or do you love to suck or give head? Is it safe? Are your lights always off when you are in an act? Are you just interested in the acts and then not the consequences thereof? Now, look at this. Don't give head or allow this to penetrate you. But your lights are off. Have you seen this?
It's on.
I mean, your lights are off. So how do you see this when you are giving a head? Those of you who say put your light off. Those of you who have been saying put your light off. When you are coming to have sex, put your light off. If you are giving head to this, your lights are off and you are giving head, or this thing is having raw sex with you. This is a genital ulcer caused by Haemophilus, a bacteria called Haemophilus ducreyi. For this particular one, this one that's on your screen, when you press the base of the wound, water fluid will come out of it. So when you are sucking this, in fact, you are sucking a fluid that is bacterially infected, and you may get sores and a whole lot of bacterial infection, oral infection in your mouth. You are giving head to this. And look at this one. So this one is called soft chancroid. This one, the one that you can see on your screen right now. And then this one is syphilis. This one is syphilis. So syphilis is called hard chancroid. For syphilis, when you press it, the wound does not bring out any fluid. But for this one, soft chancroid, when you press it, the wound brings out fluid. So this one, syphilis, is caused by a bacteria called Treponema pallidum. It causes syphilis. This one is caused by a bacteria called Haemophilus ducreyi. Haemophilus ducreyi. So look at this one. Look at the pens like this one. And look at this one. Look at this one. So all these have been penetrating people, and people have been giving hair to this penises that are not worthy to enter a vagina even raw. But yet people give head because their lights are off. Okay. So these are all genital ulcers from a man. And look at this one. This is what we call epididymitis. This is gonorrhea in a man. Gonorrhea in man is called urethritis, inflammation of the urethra. And one of the complications is epididymitis, like you see here. The scrotal sac will be big. The reason is that you see the epididymis is the part of the scrotal sac that temporarily stores your semen. So if you have epididymitis, you may be infertile as a man simply because your epididymis are swollen, so you may not produce quality semen enough, okay, to impregnate. Okay, but this is what you call uncircumcised penis anyway. So this is epididymitis. That is one of the complications of gonorrhea in a man. But this is classical gonorrhea in a man. So the pus that is coming out is that this is actually the discharge when a man gets gonorrhea. The similar discharge comes out from the vagina when a woman has gonorrhea. So gonorrhea in a woman is called endocervicitis. Endo means inside. Cervicitis means inflammation of the cervix. So gonorrhea is actually an inflammation of the cervix in a woman. So it's called endocervicitis. And don't forget, the cervix is the womb to the womb. Is the entrance to the womb or the door to the womb. So when a woman gets gonorrhea, it's actually dangerous because the infection can protrude, the infection can enlarge and attack the womb. Okay, and it can lead to saphengitis, which is inflammation of the fallopian tube. So this is a man with gonorrhea, and when it happens like this, when this thing dries, it covers the pineal canal. So when you are peeing, the wee may break into 2 or 3. Then a man sometimes foolishly will say, I'll give birth to twins. You are dying. You are not giving birth to twins. This is gonorrhea. So whenever you are urinating and then the urine splits into 2 or 3, it means it's a sign or something that you have gonorrhea as a man. Simply because when this thing dries, it covers the pineal canal, the entrance to the penis. So when you are peeing, you'll be like you are struggling. So when the urine ultimately comes out, it will break into 2 or 3. Yes, it's something like this. So when it dries, it becomes something like this. When you're a man and you see something like this, know that you have gonorrhea. Okay. And when a woman has gonorrhea and then she doesn't treat it, she gets what you call, the baby. When if there's no breach and then the baby comes with a head, because the gonorrhea is in the cervix, the discharge is in the cervix of a woman, the eyes of the baby actually gets filled with a discharge from the woman. So the baby ends up getting what we call ophthalmia neonatarum. Okay, the baby becomes partially blind, and the baby might not be able to open her eyes, and then the baby will be producing abnormal discharge from the eyes. Once you see this, you know that the woman had gonorrhea. The mother, the mother who gave birth to the baby had gonorrhea and never treated it, and it has affected the baby. So normally in the hospitals, we put silver nitrate on the eyes of every baby, or we give erythromycin drops on the eyes of the baby, okay, just to prevent this one. I'll stop here, and then I'll take questions. Okay, I'll stop here and I'll take questions and see. So if you have your questions, you can raise your hand and you say it. So these are the questions. Hey, the questions are not coming on. So how can the vagina regain normal flora back? It regains normal flora when you stop using those things that you are using. Those things are normal flora. They are naturally there. So when you stop depleting them, they will come back. Okay. So the next one, they are saying that the questions. Sir, please, does douching affect normal flora? Yes, it affects normal flora. When you douche, you kill your normal flora. So you get all those things that I'm talking about. What is it? Sir, please, is epididymitis the same as varicocele? No. Varicocele is different from epididymitis. Varicocele is different from epididymitis. Okay, in varicocele, your varicose veins actually become inflamed, sort of. In epididymitis, you just have inflammation of your epididymis, and then you see it outside as you saw. Okay. In men, infections can lead to shrinkage of the penis. Does it also apply to the vagina? No. For the vagina, when you get gonorrhea in a woman is called endocervicitis. Please note, we are dealing with different infections here. Today, I've spoken to you about candidiasis. I've spoken to you about bacterial vaginosis. I've spoken to you about gonorrhea in a man called urethritis. Gonorrhea in a woman is called endocervicitis. Gonorrhea in a baby is called ophthalmia neonatarum. So in men, gonorrhea in a man can lead to shrinkage of the penis. But in a woman, it does not shrink the vagina. It would only lead to the production of abnormal discharge that may itch. So sometimes you can scratch till your vulva becomes red as a woman. Once you are scratching and you are producing abnormal discharge, and then the discharge is like like it's slippery, okay, then you know that it's gonorrhea. You need to buy cefizime or ceftazidime. Normally we use cefrozime or cefizime to cure it. 200 milligram TID for like 1 week, okay. Sir, please, can depletion of the normal flora cause vaginal wax? No, but it's not wax, it's vaginal warts. Vaginal warts is caused by the same virus that causes human cervical cancer. So the virus is called human papilloma virus, HPV. So that same virus that causes cervical cancer is the same virus that causes genital warts or vaginal warts. Let me show you vaginal warts. Okay, let me show you. So vaginal warts is here. Vaginal warts. So this is vaginal warts. This is what. This is vaginal warts. So the same virus that causes cervical cancer is the same virus that causes vaginal warts, as you can see here. So the men who have been licking the chronic lickers, if you lick this one, you get human herpes simplex virus 1. That is oral source. So the men, you'll be there, you are not sick, but you see cold sores, what you call the tree as in on your mouth. Ask yourself, you have been licking a woman, go and check the vagina of the woman. Maybe the woman has vaginal warts. Please check the men too. All right. So this is hand warts. So those who have been fingering women, and then the woman who are fond of putting your fingers into your vagina most often. If you have genital warts, and then you infect if you put your hand in your vagina, you may end up getting hand warts. And the woman and the men who have been fingering the woman too. So if you're a man and you see this on your finger, you are not a man, you are not a woman. So how come you have warts on your hand? How did you get the human papilloma virus? It means you are a chronic finger. You have been fingering women. Stop. Other than that, your warts will increase. And then we have this. Oh, this one is not clear, but this is a vagina with warts. This one is not. It's not clear. So let me go back to the comment sections to see if I can have questions there to answer. Sir, please, can a baby have vaginal candidiasis from the mother during birth? No, please. No, please. A baby cannot have vaginal candidiasis from the mother. Don't forget, when the baby comes out with the head, if there's no breech. So it's only the eyes that can be infected. And then so the bacteria that causes gonorrhea, Neisseria gonorrhoeae, actually enters into the eye, and the baby can get gonorrhea rather, not candidiasis. Okay, because I was once approached by someone saying her baby has candidiasis. There's a discharge of fluid. You see, the mistake is that whenever they see abnormal discharge, they think candidiasis. But you see, gonorrhea can also lead to abnormal discharge. Candidiasis can lead to abnormal discharge. There's another infection which I forgot to show you. I'll show you. It's called trichomoniasis. It's caused by a parasite called Trichomonas vaginalis. In fact, that is whenever you have an itchy vagina, that is the first thing that you should look out for. That is why whenever you go to the hospital and then you have itchy vagina or your vagina itches, we give you flagell. You are a nurse and you say fragile. What are you frying? It's not called fragile. Even the old man will say, Pachometo fragile. Please, it's called flagell. Another name is called metronidazole. You see, the parasite that is called Trichomonas vaginalis has a flagella. The flagella helps it to move. So when it's moving, it uses the flagella to move. So it's the beating of the flagella along the vaginal walls that causes the itchiness. So we give you flagell or metronidazole, okay, to to prevent the, how do you call it? To prevent the itchiness. So once you take a flagell, it kills the flagella or takes away the flagella. I had a video here. I don't know. Oh, I had a video of it. Good, it's here. I don't know how it will play for you to. Oh, it doesn't play here because it's my phone. But the video you say you could have played it, so I had it here, so you could see how why you take flagell. Okay, so it's not playing. I don't know why it's not playing. Let me see. Let me try again. It's not playing, but you could see that there will be a parasite that is moving in the vagina, and as the parasite moves, it's beat along the vaginal walls, and that is also one of the causes of the itching. Okay, so that's why we give flagell. So Trichomonas vaginalis infection can lead to how do you call it? Discharge. Candidiasis can lead to discharge. Bacterial vaginosis can lead to discharge. So if you see a discharge, it doesn't mean it's white. So stop how do you call it? Abusing drugs and all of that. You think it's white, you go and take fluconazole live or suppository. And then that's why nowadays fluconazole does not even work. Because you think every abnormal discharge that comes is candidiasis. No. So please stop. Sir, please, can excessive intake of meat affect the normal vaginal flora? No, please. Are pregnant women prone to candidiasis? Yes. I told you that one of the people that are prone is pregnant women and people who have diabetes, simply because in diabetes, when you pee, there is a bit of sugar in there. So when the sugar gets into the vagina, actually, the sugar, the Candida albicans loves sugar. Okay, you remember the Candida is a fungus. That's why we put yeast into bread. The yeast contains sugar. The yeast contains sugar. Okay, so anytime sugar passes through the vagina, okay, you are actually allowing the Candida albicans to grow and suppressing the growth of lactobacillus acidophilus. That is why the old women will say that stop eating toffee, else you get Candida. It's not like the Candida is in the toffee, but when your blood glucose level increases and then you pee and then there's glucose in the pee, you see it enhances or allows the Candida to grow and not the lactobacillus, and it may lead to white. That's why. Sir, please, can excessive sir, please, can water lubricant gel? Please don't put anything into the vagina. Anything you put into the vagina, lubricant, whatever, in fact, affects your normal flora. Sir, please, can water lubricant gel like Thai gel? No. Please stop talking. The person talking, you are disturbing me. So when you use a lubricant, okay, when you use a lubricant, it doesn't where am I? It doesn't disrupt your normal flora. No, because the lubricant does not contain any chemical that kills the normal flora. It's the pH of the lubricant is 7, so that one has no effect. Please say how safe is taking probiotics for vaginal health? Yes, you can take probiotics, but make sure they are in the right concentrations. Okay, make sure they are. You see, go on there. You don't need to take all those things. Just make sure that your vagina is clean. Don't use any chemical there. The same water that you are using to bath, okay, put small amount of Dettol into the water that you are using to bath. After bathing, put some of the water into your hands. I mean, splash it into the vagina. Just use one finger. Don't even go deep into the vagina. Just around the vulva. Just wash it. That's all. It's clean. Don't have to go and put things there and all of that. And that's what brings all these infections. And I'll be there. They will call you, take hospital, you go. What's that? So some of these things, that is what it is. Let me finish with the questions typed before I come to the normal ones, please. Okay. Sir, send a video to our platform. Yeah, I'll do that. Sir, please, can lubricants? I've answered that. Sir, please, can water lubricants? I've answered that one. Sir, please, can excessive intake? I've answered that one. Are pregnant women prone? That is true. Sir, please, is there abnormal vaginal discharge? Sir, please, if there is abnormal vaginal discharge, but you are being tested and it's not an infection, what does it mean? There can never be an abnormal vaginal discharge and then you are being tested. It means the lab technician does not know what he's doing, or the doctor who prescribed the test didn't diagnose you well. Anytime you have abnormal discharge is either gonorrhea or trichomoniasis or white. But you see, most of our hospitals are not well resourced with the labs. So they test for one, they only do high vaginal swab to test for candidiasis. And then if there are no yeast-like cells, they say, okay, no candida found. What about gonorrhea? Most of them don't do gram staining. We'll talk about gram staining next 2 weeks. Most of them are not well resourced to do microbiological tests. So it may be suffering from gonorrhea. So if the candida comes out negative, what about Trichomonas vaginalis or trichomoniasis infection? What about more friends saying gonorrhea, or let me say endocervicitis? So sometimes the doctor may give you cefizime or may give you doxycycline, a start dose, okay, against some of these infections, or cefizime 200 milligram TID for like 7 days can also solve, can kill gonorrhea, okay? So, or penicillin, start dose. So some of these things, that's why sometimes the doctors use their discretion, or we use our discretion, okay, to treat, because most of our labs are not well resourced. Those of you in Tips compound and in district hospitals, they are not well resourced. Some women use joy ointment. Please, joy ointment for no. I don't know the active ingredients in joy ointment, so I cannot advise you. But what? That's up to you. If you are using joy ointment and then you're having abnormal discharge, don't come to my hospital. Because if you come and ask me and you are using joy ointment, I will not even mind you. Why would you use joy ointment? Master, you can do things that will make the place wham. Stop using those things. But if you are using it and you think it's okay for you, don't have any abnormal discharge, that is fine. Sir, please, the habit of washing vagina with water after urinating, is it healthy? That's fine. Water is neutral, so it doesn't change anything. That is fine. Water does not wash away normal flora. Don't forget, the normal flora, they are not in the vagina like the vagina. They are in the tissues of the vagina. So anything you put there that disperses or that actually enters into the tissues, it kills them. Water does not enter into a tissue and kill anything there. Okay. Cefizime 200 milligram TID for 1 week. Okay. That is for gonorrhea anyway. Sir, please, can a baby have so now, yes, I think I've answered all the questions. Sir, please, is it safe to put hot water? No, don't put hot water into baby's vagina. I don't know why they do that. I don't know why they do that. But when you put hot water there, the temperature becomes, like we said, it becomes thermophilic. Lactobacillus acidophilus is a mesophile. So when you put hot water there, it will kill the Lactobacillus acidophilus there. So most children, before you grow up, you are already getting candida simply because of that thing that they have been doing anyway. So it's not advisable. Sir, please, can excessive intake of meat? No, it can't lead to any of this. Sir, please, does natural remedies like cloves affect normal flora? There's nothing like natural remedy. The natural remedy is that God has given you a natural remedy. And that's Lactobacillus acidophilus. Keep it clean. When you keep Lactobacillus acidophilus there, it helps you. And those of you using boric acid, the concentration is supposed to be 4%. 4% boric acid. And even that one, when you are peeing a lot, maybe you have diabetes or you are pregnant, that's when we use boric acid. Because boric acid is used as a preservative for urine. So when you use boric acid, maybe it prevents your place from smelling. That is when you are peeing a lot. But if you put it there and then you don't even know the concentration, you go and stop it, suppository, you kill a lot of these bacteria, which are normal flora in there, then you begin to have abnormal discharges. So please stop. Unless you know the concentration of the boric acid and you know your way about it. So please, what about Savlon? We have been using to bath our female babies. Is it advisable? Savlon is fine. It doesn't have any effects. So please, what causes abnormal vaginal discharge? So abnormal vaginal discharge can be as a result of endocervicitis, that is gonorrhea in a woman, or Trichomonas vaginalis infection, or candidiasis. That's what causes abnormal. It's abnormal because the normal one is supposed to be given by lactobacillus. Now it's become abnormal because you have made it abnormal, simply because you are using certain things. All right. Boric acid, I've spoken about boric acid. So now, those of you who are online, you can raise up your hand and ask your question. Yes, Abdul Rashid Mahama, ask your question.
So my question is mostly for the women who are affected with this candida. Maybe you may not see the white coming out, but once you inserted your manhood inside and you are bringing it out, it's likely possible you see some kind of white traces around your tip or at the ring.
No.
Is there any other?
No.
Is there any effect?
Let me educate you on that. No, there's no effect, first of all, on a woman who has candidiasis and you sleep with her. No, you don't have to lick her. But if you sleep with her with the manhood, there's no effect of candida on the manhood. But what you see might not necessarily be candida. The woman may just have cream. There are some people, when you sleep with them, they cream. Like they produce certain chemicals like ice cream. So we call them creamy pussies or creamy vaginas. So what you see might not be candida. It's just cream. The woman, sometimes, some of them excessively produce discharges. And then the normal discharge or the normal wetting is actually cream in color. So you may think it's candida. No. And some of them do cream. Like they produce something like ice cream.
I'm learning.
Yes. So that is it. So that it might not be it.
Oh, no problem.
Yes.
Thank you very much.
Yeah.
And
So sometimes you
if
say
the man is having
vagina or
this genital, if a man is having this genital what likely medication can we prescribe?
a man cannot have genital what? It's a woman that can have genital what, but a man can have hand what? When you as a man, you can't go and insert your hand into a vagina of a woman who has genital what? You can get hand what. For a man, you cannot get genital what. A man, you can the only infection you can get on your penis as a man is one. If it's a sore, it can be syphilis, or it can be chancroid. Those are the only or Klebsiella infection. Those are the only things that you can see from the genitals of a man. But for a woman, you have genital what? For genital what is human papilloma viral infection. So you go to hospital, we can surgically remove it. We can scrape it off. But you see, if you scrape it off and then you have the same partner and the partner also sleeps with someone, it means the man has been getting the HPV from another woman and has been bringing it to you. So if you surgically remove it and it comes again, it means ask your husband or your boyfriend. That's what it means.
Okay. And the shrinkage of the penis, is it likely the only cause is gonorrhea, right?
The what?
Shrinkage of the penis.
Yeah, gonorrhea. Yes, gonorrhea. Yes, gonorrhea. Chronic gonorrhea.
So how do we let it go?
Cefizime. You buy cefizime. So you are doing pharmacology. You should have into so cefizime, because the gonorrhea is gram-negative intracellular diplococci. So you buy cefizime, a gram-negative antibiotic, cefizime 200 milligram TID for 7 days to 2 weeks. You should be able to go. Yeah.
Okay.
All right.
Thank you.
Good. Yes. Any question? So we have roughly 10 minutes to go. Yes. Esther Akins, please hurry up. Esther Akins, hurry up, because a lot of people want to answer.
We were having a talk, and I was educating people on women on personal hygiene. And personally, I told them that the area in between the labia minora and majora, that area, you see, at times after day's activity, you can pass your finger there and there is sort of a substance, at times it's greasy, like just as when your body is dirty, you have that substance. Okay, so I was telling them that for that area, at times you can wash it. Let's say if you are bathing, you can wash that area. And the midwife came aggressively saying that at the vulva, nothing like soap or anything is permitted over there. So I was trying to tell her that it's not into the vagina, but just around that area. And she kept saying that there is a normal flora to keep the vagina clean. But personally, I do that and it works for me, actually. So I want to find out that the normal flora we are talking about, we have some in the vagina that keeps the vagina. But the area, especially that in between the normal flora and the labia minora and majora, is it advisable, let's say when you're bathing, you clean that area maybe with your sponge and soap, or you wrap your finger with
the midwife is right. The thing is that anything scented contains chemicals. Anything that has strong scent contains chemicals. So you see, you are talking about labia majora and labia minora. Is it that place is okay? But if whatever thing what you are putting there is strong scented, it will disseminate or dissipate into the tissues and will kill the normal flora there. So it's like, see, we say that exclusive. You say exclusive. The reason why the exclusive came is because you may want to give your baby water. How sure are you that the water you are giving to the baby is safe? So pano chano exclusive. Don't give it even water. I hope you understand. So what you are right, and then the midwife is right. You see, anything you put there, once you educate someone, the person might not be educated as you are. The person will go and put scented soaps, strong scented soap there, and then it would disseminate into the vaginal and labia regions, and then kill all the normal flora there. Then the person will begin to have abnormal flora there. So that's why sometimes we say don't put anything in the vagina at all. Don't just leave it.
But so how do we, because this thing I'm talking about personal, you see, you can wrap, and so how do we get rid of that? Because at times,
yes,
yes,
I get you. So that I can take other questions. I get you. Let me answer you. So don't use any chemical. You can use water in towel. Just dip the water in the towel. Then wipe that area. All that we are saying that we want to prevent chemicals from going there. That's all.
Sir.
Yes, ask the question. The next person, please be fast.
Sir, please, is it possible to have candidiasis and treating it and then it it wouldn't go for some years.
So if you are treating it and it's not going, it means that you are resistant to fluconazole, or you are still doing the same thing you are doing while treating it, because you are still using something which you are supposed to use. Maybe you are on antibiotics treatment and you are still treating candidiasis, it won't go. Or you are diabetic and you are treating it, won't go. Or you are doing something which I have said a lot today. So check what you are doing. Other than that, it won't go. Someone said, what is appropriate treatment for prolonged syphilis? For syphilis, you take doxycycline. Doxycycline 200 milligram. Sorry, doxycycline 100 milligram for 2 weeks. It will go. Okay. Please say, are there supplements or specific diets that helps to improve, maintain lactobacilli in the vaginal normal flora? Which supplement? It depends on the supplement you are talking about. Okay. Chili's pH. Yeah, is it Chili's pH? You are telling me Chili's pH is 5.5. Who told you? Have you tested using pH meter? They are telling you 5.5. You see, if indeed it's 5.5, it's good for the vaginal ecology. But there are other ingredients in the chili that may kill the lactobacillus. Who certified the chili to be used? What are you using the chili for? God placed normal lactobacillus acidophilus there to maintain the normal vaginal ecology. Why are you tempted to go and put anything there else? So that's your own question. So yes, those who have raised your hands, let me take Samuel Jachi. Please hurry up, Samuel Jachi. We have a few minutes.
Okay, sir. Please, you mentioned that when we're treating the gonorrhea, especially for the male, the picture you showed about the creamy discharge from the penis. Is it always a case that when there is creamy discharge from the penis, not accompanied with other symptoms like pain and swelling, it is attached to gonorrhea?
Yes.
My second question is, you said also oral thrush. You said explicitly that if a male has oral thrush, it means you're talking about the leaky, blah, blah, blah. I don't know whether it's just for sarcasm or it is really the case. And
that's
finally,
the case. When a man so let me answer so that
yeah,
when a man has oral thrush, it speaks of two things. Either the man is HIV patient, or the man is immunosuppressed. It means he has done liver transplants or kidney transplants and he has gone to lick someone. Me, I don't have HIV. So if I go and lick a woman, an normal circumstance, I shouldn't have thrush. But if you go and lick someone and you have thrush, it means that you have HIV patient. So you are battling with your immunity. Or you are a chronic licker and you have been licking someone who is chronically having candidiasis. And then you the licker, you are also HIV patient. So that's true. Anyway, and then the gonorrhea you are talking about, anytime you see the symptom that I showed you on the screen, it means you have gonorrhea, whether or not it's accompanied by other symptoms. Some people may have only one symptom, some may have 2 or 3 symptoms. Some people may see the pus, that fluid that came out, together with itchiness and swelling and all of that. Some people may not see it. So you just need one symptom to be sure. For gonorrhea in a man, that is the main symptom. That's fine. Let me take Hannah Edu.
Okay,
Hannah Edu first.
I'm not done, please.
Okay.
So like, say for instance, I have male clients or people who come, most especially they talk about this white discharge that come immediately after maybe they strain, after maybe they have gone to pass 2. It doesn't come immediately when they are done, maybe after they have finished passing urine, then that discharge accompanies the urine. So is that also
it's still gonorrhea?
Just that is gonorrhea.
Yes, it's still gonorrhea. So you see, the in gonorrhea in a man is dangerous. Sometimes you may not really see it well. It will make you impotent. For a woman, it will come out, they will experience the symptoms faster. For women, they will experience the symptoms, but for man, it keeps long before it comes. So they should treat it. It's gonorrhea still. They should treat it, or they become impotent.
Oh, okay.
So please, can a man
Can we see your face? Can we see your face? You can see your face. Of course. We're very glad.
Now you can see my face. Can you see my face now?
Oh, okay.
Can you see my face now?
Yes, we can see your face now.
So I can take it off, right?
That's nice.
We have not seen your face.
We
like it this way. We didn't see your face. So we didn't see your face.
This is my face.
Please, your number. Yes. Very necessary. Your number. Very necessary.
Yes, you see you are bad. You see you are bad. I am single. I'm single. Come. I'm single. Let me take my questions anyway.
Yes, sir. The man question. Hello, sir.
Yes, talk.
My question is, can men also have the HV2 virus?
Yeah. No. So a man can have HH1. Okay, human herpes simplex virus 1. Okay. That's what causes the cold sores. The 3 people or that can be caught in your you'll be there and then there will be some rashes on your mouth. They normally say because you are about falling sick. That's why. It's not always true. If you have nyahono, it means that ask yourself if you have left the woman.
Hey, this will look like my
Okay,
Yes.
but it can't happen on a penis, right?
No.
Okay.
No. Yes.
Sir, please,
Yes.
the genital what?
Uh-huh.
Can it travel to the cervix, around the cervix?
Yes, it can go inside. In fact, when you have genital what, you are at a risk of getting cervical cancer. So it will surely go to the cervix.
Okay, so you said with the removal, it can be surgically removed, but
Yes.
around the cervix, how are they going to treat?
Around the cervix, no. But the one that is, you see the picture I showed you, it was just around the vagina.
Yes.
Yes, that one can be
Well,
removed
I'm
surgically.
talking about the one around the cervix because I've seen one around the cervix, and I refer the person to doctor.
Yes, you can
And
remove it, but that one you can remove it surgically. You can remove it surgically if it has not disseminated. If it's localized around one area, you can remove it. But if it has spread all around the cervix, it's dangerous because you may rupture the cervix.
Yes, spread around the cervix.
No. Then it's not possible.
Okay.
Yes, please.
Thank you.
Yeah. Yes. The next person. Hurry up. The next person. Garden City host. Can you please give me 15 minutes more? How do I even? So let me send a message to the Garden City person. Please talk. The person asking your question. Please talk. Please talk. Hello. Oh. Hello. Okay. Yes, Abigail Mensah, please ask. Abigail Mensah, please talk. Is it from my end or? Okay, Abigail Mensah is not there. Okay, Bushiri Karim, ask.
Hello, sir.
Yes, talk. Yeah.
Please, my question is sometimes I feel heat around my groin side. Is that one too an infection?
You feel what?
Heat around my groin.
No. Around your groin. When you say groin, do you mean in and around your pelvis symphysis? Your anatomy.
Yes.
I hope your anatomy is strong. I don't know. When you say your groin, I have to be specific. No, but anything heat, that's not what I'm talking about. So even if it's an infection, it has nothing to do with what I'm talking today. You can message me back door and I'll talk to you about that. So it's different.
Okay.
All right. So next person, please talk. Be fast. Who is talking? Sir, please, can you combine Cipro and Doxy for UTI? Yes, we use Cipro for UTI, but Doxy for not usually for syphilis. So Doxy is not used for UTI. So if you went to the hospital and he gave you Cipro and Doxy, it means that the doctor is also suspecting syphilis. That is why he gave you Doxy. But Cipro is for UTI anyway. Yes. Please, who is talking? Kakona, when you come to my DM, I may not mind you. So ask now. You have your time. Okay. Abdul Malik.
Please, UTI, can we give IV ceftriaxone 2 grams start and then continue with orals?
Which one?
UTI.
IV what?
Ceftriaxone.
No, it's not really the best. For ceftriaxone, is normally given for gonorrhea. For UTI, either you use Cipro or use amikacin.
Amikacin, okay.
Yes.
I have a client. His penis has more because he was having syphilis for like 5 years now. How would the penis?
The penis has now
has become small, very, very small, like my little finger.
So he doesn't only have syphilis; he has gonorrhea too.
So say, how would the penis become big?
No, unless he has to cure it. He has to cure it. He has to take medication. He has to be taking doxycycline and ceftriaxone to cure it.
Doctor prescribed benzathine that we are giving to him, but he wants his penis to become big, like to rise again. It's not even rising.
And just Dr. Amuju.
I may come into now.
Because
please,
I'm only trained to cure your Doxy and then your other one thing. What's the name? The Doxy. Sorry, I'm only trained to cure your syphilis and then your